The views and opinions expressed by guests are their own and do not necessarily reflect the views of Forge Fitness and Nutrition LLC, the podcast hosts, owners, employees, contractors, partners, or affiliates. This presentation may include the use of explicit language. Listener or viewer discretion is advised.
Hello, everybody. Welcome to the Forge Fitness, Nutrition, and Habit podcast. Today's episode is going to be very interesting. We're talking about stronger hearts. Essentially, fitness after cardiovascular recovery, but also how do you protect your heart for the rest of your life? I have with me my good friend, Cameron Lemieux. He is a clinical physiologist with an advanced degree in cardiovascular recovery and rehabilitation. Cameron, thank you so much. Why don't you go ahead and introduce yourself to the folks and give us your download about your history and the general hello.
Thanks for having me, man. I'm super excited to be talking to you just in general, but especially with my point of emphasis in cardiovascular health. So to go into my background and essentially how I got into this, I was an overweight kid myself. So got to high school, used to play sports, and then I started working. And then, of course, less activity, more eating. And then there you go. That results in a little bit more fat gain. So eventually I kind of had an epiphany and was like, I need to get in shape. I think I was 17 at the time when I really started taking it serious. And so started going to the gym and just doing very basic stuff. I ended up losing about 70 pounds. After that, I obviously started looking more into it online. So seeing different workouts, nutrition ideas, and realized there's a science to this. So piqued my interest. I've always been a big science guy and kept doing further research and then really decided, you know what? I'm already kind of looking this stuff up on my own. I'm tired of not knowing what's true, what's not, because obviously if you're going to different sources, you just don't know. So I wanted to get a formal education in it. So then went to the University of Central Florida, where I got my bachelor's degree in sport and exercise science, which led me to finally seeing the clinical side of things. So once you get into a little bit more of collegiate education regarding fitness, it's not all just push-ups and jumping jacks and so forth. So as you know, got into anatomy, physiology, all of that great stuff. But what the class that really essentially changed my point of view, it was more of a metabolic health class. And we were basically going over ACSM guidelines and going over what to do with patients who have recently had a heart attack or had a stent or had bypass surgery. And all of the remedies were having their surgical intervention, but it all resulted in a form of aerobic exercise, some version of strength training, and of course, flexibility in there. And as dumb as this sounds, I just had never thought of exercise in the clinical population outside of like physical therapy. I had no idea what cardiac rehab was at that point in time. And so my world was opened up and I was like, this is very cool from a clinical standpoint. I always thought like scientists in a clinic setting was super cool because of, Rocky 3? Remember that, where it's like he's fighting the Russian guy and he's got all this high tech stuff. Like he's hooked up to an EKG. He's hooked up to an oxygen mask. He's got like doctors there. That's Rocky 4. Okay. I thought that was the coolest thing. And that kind of was, I guess, my foot in the door in that regard. It's not necessarily the same thing, but in the clinical side of exercise physiology, my world was opened up. So took that and ran with it. I used to talk to my professors a lot about it and then really just still had an urge to learn and went on to get my master's degree in exercise and nutrition science. We had tracks there and mine was a more clinical track that emphasized cardiopulmonary rehab and different ailments or comorbidities and diagnosis that not only qualify for it, but how to help them on the exercise and nutrition side of things. So that led me to getting my internship at my cardiac rehab I currently work at. And then starting from square one, I essentially went as an intern, unpaid. So put in my work. I had never learned so much and such. I think I was an intern for about 2 months and just, they gave me so much material, allowed me hands-on application, which is crucial in our field, as you know. And not only that, but they were constantly teaching me and giving me material as well as my formal education. But formal education only gets you so far. It's great. I'm not discounting it, but until you're really applying it and seeing what actually works, there's a lot of stuff you might learn in the text. That's not, I wouldn't say wrong, but it doesn't apply as great as you may think in real.
You mentioned a little bit about your history as a young man who was struggling with weight, and then you kind of fell in love with the science of physiology. But what made you passionate about working with folks focused on heart health and recovery?
I didn't have anything per se that was like an aha moment. I did some visits and things like that to really see what it's all about, but I didn't have really any frame of mind until I finally got my internship and saw not only the science of things in real time with the cardiac patients. So we hooked them up on EKG telemetry, being able to read and interpret EKGs. I always thought, not only is that a cool skill to have, but I just found it generally interesting. I don't know. And so not only that, but having it essentially dealing with people when they come in from, especially in particular bypass surgery, they went through a lot. I mean, to say a lot is an understatement, but just to keep it brief. So they've had their whole world upside down, right? That's open heart surgery. And that happens obviously, of course, often, way more than maybe people think. And so I really fell in love with seeing how people come in and they're very, very scared and they feel like they have nowhere to go, and being able to be there not only for them and educate them that, hey, no, this isn't the end. We're not just done here. We're able to start off with light movement and it's going to be strategic, but we should be able to get you back to where you were before. So a lot of people think that their life may never be the same. Now, there are varying degrees to that, but to take out the nuance of it, that's usually not the case, mostly dependent on age. However, I saw that with my personal training clients. General population, seeing them feel like they couldn't do much exercise to being able to squat with extra weight or do multiple push-ups, whatever it may be, whatever's their goal. And taking it to the clinical side, it just was even more gratifying because you're helping people who really feel like they desperately need your help. At the core of it, I generally do enjoy helping people, especially in this regard, because I do think there's a lot of misinformation out there. Of course, as I think everyone would agree with that. And it's very confusing as well because there's so many sources, what's true, what's not. So I feel a lot of pride that when people come in to our clinic, we can really guide them, through that misinformation and then have them taking giant leaps ahead, with due time.
This is a high level specialization. Was there something that happened to a friend, a family member, or was just an interesting calling?
That's a good question. I actually hadn't been asked before, but if I had to put a real life situation, it would probably have to be my Uncle Jack. He had very poor heart health due to a lot of different things, mostly stress and not going to the doctor when he should have. And it eventually, unfortunately, was his demise, and he ended up having a quadruple bypass. And I was fortunate enough to see him shortly afterwards, and we had great conversation. And one of the main things that stuck with me that he told me was, he says he didn't regret anything because in certain aspects, because he worked very hard, more of a blue collar guy. He did anything for his family. And he said, unfortunately, also at the cost of my health. So he led me with two things. He said, don't let your pride get in the way of your own health. If you're not feeling well, maybe go see somebody. So pretty simple, but good advice when you're hearing it in the context. And also the fact that he felt it was essentially too late to bounce back from that point. And he definitely had a few other ailments. That wasn't the only thing, but I was already I was in my exercise science path. He told me going through rehab and things like that. That was my first hearing of okay, that's a treatment for, heart disease. Like I said, it just wasn't in my realm. I was just dealing with younger, healthy individuals. And so I started doing my own research to see what it's about. And then I guess ultimately that kind of led me there. I wouldn't say it was the main thing, but maybe now that I'm kind of pondering it upon myself it was the initial driver to even get me looking in that direction.
I could see how that had shifted your perspective. Whether or not it was highly conscious, there's always little indicators in our lives that kind of drive decision-making that we don't sometimes acknowledge. I want to follow up on something you had mentioned about how he said it was too late, all the kind of layered excuses that people have, which sucks because we're talking about your heart. But why do you think so many people just ignore their cardiovascular health until it's a crisis?
Awareness is the right word. But the precision in what we talk about heart health has kind of been the same for a long time, focusing on aerobic exercise and very basic things. And obviously that's a key driver to improve heart health. However, we've had a shift of, especially as you know, being in the personal training industry, a lot of people will neglect aerobic exercise, but do a lot of strength training. And that's very, say that again?
Or vice versa. As a quick interjection, I bet people do have a tendency to prioritize one activity over another, and they don't create an all-encompassing wellness plan. I have found that in general, that women have a tendency to do cardio. They're on the Stairmaster, they're on the treadmill, they're doing an elliptical trainer. And I think that the older the lady, the more predispositioned she is to do that. The only value that I could probably attribute to social media is women lifting, which I'm a massive advocate of. I think every single woman by the time her growth plates have solidified somewhere in the mid puberty or higher, all the way to the day she dies, women should be lifting. But I think men have a tendency to lift more than women, and then they ignore their cardiovascular health. And especially since a lot of that anaerobic activity doesn't allow the heart to exceed a certain BPM. So it's not really working the heart. Now, there's HIIT training, and there's ways to incorporate higher elevation of heart rate during strength training, but men do suffer from heart attacks. But heart disease is the number one killer of women in the United States, and it has been for decades now. That is what takes the American lady out. But it's weird though, because I thought women just did mostly cardio, except for now, like obviously we see more in the strength training areas. What do you think about that? Like,
Kind of want to go back a second here because I want to add on to what I said. Not only is it the education may not necessarily be there, or I don't think it's targeted well, but I think especially right now, a lot of people think of aerobic exercise or cardio as a fat loss tool, which of course it is. I'm not denying that. However, I try to constantly educate people, and even my clients, I say, yes, it's going to help fat loss, obviously, but that's not what you want to think. We're doing this to protect your heart. Obviously, that's the primary driver there. The secondary is going to be the fat loss. Of course, there's more moving pieces with that. So it's framing it kind of different. I think with fitness and health in general, everything is about perspective and a mindset. Because if you think of it like, well, even if it's something as simple like, well, do I want to die of heart disease? Everyone's going to say no. Okay, well, what's the number one thing I can do? Well, performing moderate intensity aerobic exercise is what's clinically proven to be the most effective preventing against heart disease. Not the only way, that's not what I'm saying, but it's essentially the most bang for your buck and what's been studied the most. Now, of course, we can get into the nuances of that. However, when we're only thinking of it as a fat loss tool, it's easy to trick yourself to be like, oh, maybe I'll add a couple extra lifts, or, oh, you know what? I'll cut out a couple hundred extra calories or whatever it may be. And not that those aren't good ideas. However, we're kind of missing the point when we're talking about heart health, because it's not going to hurt our heart health, but it's not going to benefit it.
On the clinical side, what is the most important thing someone should know? They had a small heart attack. Maybe it was almost a widowmaker, but they survived it. How do you advise them? How do you coach? How do you balance caution, but instill confidence in that post-heart attack?
When, let's say, because we have what's called evaluations when they come in, it's a one-on-one where we're going over medical history and so forth, medications, and giving them the layout of why they're there. There is no safer place for you to be after a cardiac event than cardiac rehab. And I'm not just saying that because I work there. It's because we have you on an EKG telemetry system. So we see your heart rate, how your heart's contracting at rest, during exercise, and post-exercise. Not only that, but we're taking your vitals before, during, and after exercise. So it's highly monitored. And obviously, if God forbid something were to happen, you have nurses I work with, and also we're in a hospital. So God forbid something happens, we can ship you right to the ER at an extremely fast rate. It does ease the anxiety that comes with it because, like we said, people have this traumatic event and maybe their stay in the hospital wasn't that great. I mean, no one loves to stay there, but sometimes it's worse than others. And they're just so beside themselves that they're like, don't want anything to do with the hospital almost. So sometimes they come in and they're a little bit more shut off or resistant. But when I lay that out and let them know that it's simply, we're here to get you to where you want to be and send you off on your own way. So I say there's going to be some changes, or I'm going to ask to just be open to some changes. What you do with your own time is up to you. However, hear me out and take what you like from it, and we can go as in depth as you may want. My essentially, not that it's a sales pitch, but it's just what I call it, is we're highly monitored. If you were to go even in after a cardiac event and walk around, let's say your neighborhood, not that that's extremely unsafe, but why not just come in and have it highly monitored at least for a month or so? And that way you can actually ease your own tension with it. A lot of people think it's like, we're going to put them through a stress test. That's like the most common thing I get. I'm like, no, it's the complete opposite. We start off with very baseline exercise, and that's highly individualized to the patient, right? So some people come in and they're able to do a little bit more than others. Obviously, right? Everyone comes in at a different strength level and different ages and so forth. Now, we also provide them with a ton of educational tools, whether it's about heart rate, what's the difference between low, moderate, and high intensity exercise, who that may be pertinent for and might not be pertinent for, and a lot of nutritional education. And that leads me to the next thing. The two main things I believe, especially in the United States, that drive cardiac admissions in the hospital and cardiac rehab are stress, also nutritional habits. I mean, dealing even just with general population, it just gets worse with time if you don't get a hold of it at a younger age. So those are usually the drivers.
It sounds to me like you basically instill confidence in others with a transference of your own. You're like, hey, listen, I'm looking at your chart. You're going to be fine if A, B, and C, if we do these things. People want to be working with somebody that has a high level of competency, and the competency is obviously ushered in with the confidence. Sometimes the confidence is not preceded by the competency. When you were talking about hooking people up to the monitors and being able to see all those things, that's great. But not everybody has resources like that or has access, or people aren't willing to do it. That's the reality.
Right.
What does cardiac safe exercise look like? Like
You're saying with me or if they were on their own?
I'm saying if they're on their own and they're not hooked up to the machinery, if they're guided by you, that's something else. What did my grandpa do? You know?
Yes. Well, and we're at a day and age where we have a lot of technology even that we can buy for pretty cheap. So educating them on different heart rate zones and why they're important is a main factor here. And the reason is because, right, our heart is a muscle, obviously. I tell a lot of my patients, all exercise is good, but not all exercises is created equal. And especially when I mean an aerobic exercise, because, walking around the mall and so forth, staying active is great, but that's not enough to stimulate your heart to prevent against heart disease. I would say find something that allows you to monitor your heart rate, whether it's a wearable, even we can find a pulse oximeter at CVS for maybe $15 or less. And this gives you your heart rate. Just put it on your finger as you're walking and you can leave it on there the whole time if you want to and see it in real time. And telling them that what we want to find is what exercise do you like or not hate so much? Because I do come to that realization. I'm like, it's not all of it is super fun. And yes, we can do things to make it fun, but sometimes it's not, especially when we're coming back from a serious cardiac event. We want it to be very basic and not a whole lot of abnormal movements. Just keep it simple. It makes sense to start. So having something to monitor your heart rate, not only at rest, but just especially with exercise would be important. And then, like I said, some people, maybe it's riding your bike. Maybe it's walking around the neighborhood. Maybe you buy a piece of equipment and you have that you use at home. It could be a treadmill. It could be anything that you like. I would say swimming, but that one with the wearables might be a little tough to monitor the heart rate, but we could lead into that. And essentially what we want to focus on is at least getting 150 minutes of moderate intensity exercise on a weekly basis.
That's the HDSM standard. American College of Sports Medicine did a giant research project on this, and they determined that 5 days a week for 30 minutes, 150 minutes per week.
You are exactly correct. And that is a minimum per week. So it varies. They do recommend, 150 to 300 minutes. Now, 300 minutes is quite a lot. I don't expect a lot of people to get that because we do have live kids, whatever it may be. Now, if you're retired and don't have a lot going on, maybe we could strive closer to that 300 mark. However, at least 30 minutes a day. And that's, like we said, getting your heart rate, usually at least 60 to 80% of your estimated maximum heart rate.
That's what I just found. Yeah.
Yeah. Is that what it is?
Yeah.
Okay. And that's what I thought it was. So 60 to 80% of your estimated maximum heart rate. That's a simple equation that can be done very fast. And so
would that be with heart rate reserve too?
So great question. Heart rate reserve, we don't use that a ton because honestly, for our population, it's not that applicable. It's really not. Now, if we have younger patients, which we do see, that we usually start teetering into like a Carbonin target heart rate, right? Where that takes into account their resting heart rate at least. But I would say for 90% of our patients who see the estimated maximum heart rate, 60 to 80% of that works just fine. So especially if we're talking, like you said, like your grandfather, that would almost work perfect. Now, of course, if they're on certain medications, it may keep it lower. Some people will say, right. And they'll say, oh, I can't get it to 80%. Is that a big deal? Not necessarily. You're probably getting there. If you're at least close to the 60% in that, it doesn't matter if it's 60 or 80, right? Or isn't always better. As long as you're in that range, we're good. We don't need to overcomplicate it.
What are some red flags if somebody is going to be exercising on their own after a cardiovascular event?
How they're feeling. I know that seems kind of as self-explanatory, but starting off with light movement. So that could even literally be walking up and down your hallway in your home. Okay. You may feel tired even after doing maybe 5 minutes back and forth. It could be something very basic. That's very normal. Where it isn't normal is if we start feeling chest pain, if we feel some pain in between our shoulder blades, shooting down our arm. Those are signs that there's a potential cardiac event going on. It's called angina. So it doesn't mean you're having a heart attack. It can, but if you're having those symptoms, it's signs and or symptoms of a potential cardiac event. So sometimes that can happen to individuals even post cardiac event or surgery, because sometimes maybe there was more blockage that they weren't able to get to. There's very different nuances there. And I'll kind of spare the details because it might be a little confusing.
A little tedious.
Yeah, yes. But at the same time, knowing that you're going to feel a little bit more tired, but are you feeling extra symptoms than tired? So tired is a very common, because maybe they just got introduced to a bunch of new prescription medications that they weren't on before. Very common side effect is you're going to feel lethargic. So that's not an issue. It's if we have other things where you're short of breath, and that's not, I'm kind of winded. It's like you're trying to catch your breath and you can't. There's a big difference there between being short of breath and out of.
And there's been some clinical data that I've been researching over the last few years, where people who are on either antidepressants or people who have some kind of problems with emotional regulation are experiencing high levels of anxiety, and anxiety sometimes mirrors symptoms of a cardiac event. Do you know of any way that people can kind of segregate that? Or is it anytime you're feeling some of those symptoms, is that a call to hospital?
A very good question. I get a lot of eye rolls when I say stuff like this, so you'll hear in a second, because people think it's almost BS. But it's not. So let's speak to the anxiety part, especially if you're clinically diagnosed and you're being treated, but then maybe you're at a point in your life where you think it could be a potential cardiac event. What you want to do is, if let's say you're feeling some type of symptoms, you don't know if it's your anxiety or maybe it's something worse. Go to somewhere, hopefully if you're home, go to a quiet room ideally, and essentially go there, close your eyes and take 10 big breaths in and out. I'm just picking 10 because you'd rather more than less. It's kind of an arbitrary number. It's easy to remember. So big inhale, big exhale. Now, if your symptoms aren't gone, meaning like pretty much gone, maybe you have a little lingering, but almost gone, then it could be something worse. However, if it's something more mental with anxiety, that I'm not saying it's going to cure it, but it'll almost eradicate it in that moment. Whereas if you were having a potential cardiac event, that's not help. Yeah. It's not going to go away from breathing alone. So that would be something simple that's very easy to remember and do if you're in that predicament.
I want to encapsulate this idea of the emotional stress and the anxiety that comes from a cardiovascular event. Then I want to move on to the mindset to recover. Let's talk a little bit about not only just in your practice with Forge, but your practice clinically. How do you help people within your scope of practice with the stress management, the anxiety? Because there's a human element to this. Oh, if you're a physiologist, then all you do is deal with the biomechanics of the human being. And I say, well, what about the person that's in the body? Because they're going to have something to say about this. How do you coach people through stress management and anxiety during this phase of recovery?
Now, great question. And it's funny you ask, because I feel like over the last couple of years, I've gotten a lot better at this. Because this is something we go over in our schooling and in certifications, but I don't think it does us justice unless we go for maybe something that's specifically more health coaching or more psychoanalysis. But I really am big on preaching optimism. So when they come in, a lot of times there's a lot of negativity, and rightfully so. Like I said, they could have had an awful time in the hospital, and maybe their surgery didn't go that well, or they didn't really get a lot of care from their doctor. At least they didn't feel that way. So they're just frustrated. And preaching optimism and not everybody's open, as you know, the readiness to learn. But if they take this, because there is no justice of being wound up about this. And I know it's easy. And I do tell them this. It's easy for me to say sitting in this chair, but at the same time, right? Stress, as I already kind of spoke to a little bit before, is what is going to make our heart health even worse. It's not the only thing, but it is a primary driver. And so if we're sitting here with built up aggression and frustration, that's going to manifest to stress if it hasn't already. And what I ask is, come in here, listen to me. We will guide you under safety protocols and try to have a little fun with it. It's not all like, we're not robots there. We try to have personalities and have conversation, but at the same time, knowing that there is only kind of so much I can do in that. And we have them fill out, of course, questionnaires beforehand. If you're familiar with like PHQ-9, like the Dartmouth COOP, these are all quality of life indexes and psychosocial assessments. And so if they score a certain score on there, then I would refer to their primary care, or if they had a psychiatrist or a psychologist already they're working with. They usually don't. So I would go to their primary care and say, hey, this is the results we found. And some people might think like, oh, you're telling them? Well, no, that's not the case, because if their score is high enough, they could potentially be harm to themselves. With that, cardiac related health, stress, and mental health goes directly into it. So it's in my scope, but that's about the furthest I'll go with it. And then usually that's where the physicians will step in and then recommend maybe some therapy with a psychologist or wherever they want to go. Every patient is different. So trying to talk about optimism, but then also letting them know what being at cardiac rehab will do for them. So I try to just I don't lay out the whole program because everyone looks different from an exercise progression standpoint. But essentially, I tell them, and I don't want to keep you here longer than you have to. My goal is to get you, if you were working out at the gym beforehand, maybe we just make some tweaks to your plan once we feel like you're ready to go back on your own. But for now, right, we take this step back to be able to hopefully take 2 steps forward and get you not only back to your plan, but even revamp it and make sure you don't come back here for cardiac related issues.
Sure. What would you say is like the biggest mindset trap that people fall into after a heart scare?
This is their life now. Like they're not going to be able to really go play with their grandkids or their kids, depending on their age, or they're going to have to almost be under supervision of some sort. The lack of independence, for a better term. They feel like they're going to have to rely on someone, especially us men. I mean, I've not gone through a cardiac procedure myself, so I can only speak to my observance, but I really can relate to understanding. You feel like you're the guy, you're in control. As men, we want to feel like we're in control of our destiny. And unfortunately, that one kind of kicks you on the ass and gives you like starts to give you doubt. And sometimes when you feel doubt like that, some people take it and like, you know what? And they spin it positive, but I wouldn't say that's the norm. There's a lot of that. The norm, and maybe I shouldn't say norm, but regardless, what's more common is feeling like they're going to have to be under some type of medical supervision for the rest of their life.
And so feel like their body betrayed them. Like now they can't trust their own body to support. Well,
absolutely. I just had a patient I was talking with last week, and he is still beside himself, and he can't believe that he had heart surgery. He's been exercising his whole life, and he doesn't understand. And it he didn't say it's not fair, but that's kind of the mentality it is. And I even actually had a one-on-one conversation with him because I like to get people out of that mindset, because when you start to get closed off, it can get really dark, and that only leads you back to potentially us or having another cardiac related issue. So I don't feel like I'm fully doing my job there.
Yeah.
So, and I genuinely do care about this because, like we said, mindset really is everything. And I feel like I have not only a good point of view, but my educational background and a passion that I genuinely can help these individuals. And so I talked to him and I said, okay, you were exercising your whole life. And he is in good shape. So I said, but what were you doing? Were you doing mostly weights? What was the plan? And he's like, you know what? Yeah, that I almost never did aerobic exercise. And so I said, I'm not pointing fingers or anything. That's not what I'm here to do. I said, but what are we doing here? You're doing your aerobic exercise. This is the main defense for heart disease. I'm not saying weights aren't important. Don't ever mistake that at all. They're extremely important. However, once you get to a certain stage in your life, aerobic exercise, and maybe we don't have to put one's a focus or one's not, but that should be a primary mover, because not only are you going to, feel good, you get energy and so forth. However, if you're worried about heart disease, that's going to be your main tool right there. And so that's what I say. That's when you go, strength training is needed, especially for aging because of losing muscle mass and losing strength. But a lot of people, like I said, and that's kind of why I started off this conversation a little bit ago, saying a lot of us will, even if you are active your whole life, a lot of guys, it's strictly weights. And I was there once upon a time myself. So I'm not sitting here acting like I didn't do that. I don't like hypocrisy. I got to do what I need to do. But it's funny because I always feel good after my aerobic exercise. Not that I don't with weights, but it's a different kind of feel when you're done with an aerobic workout compared to a strength workout. Aerobic energy system is quite fast. And as long as you are keeping your heart rate typically in that 60 to 80% range of your estimated maximum heart rate, it's going to stay in there. But going back to that essentially was like, you know what? I appreciate the conversation, because he kind of even said, I kind of needed to hear that little, not tough love, but that perspective of maybe you weren't doing everything correctly, and that's okay. But what do we do from here as we learn from our mistakes?
you have this incredible talent of blending fear-based motivation with love-based motivation. And so it's this interesting blend where you don't pull your punches. You say what you need to say, but the way that you say it is so uniquely Cameron. There's this authenticity. There's a genuine compassion that comes across. You have this really unique way of saying what needs to be said. I wanted to talk a little bit more about some things off the cuff.
Okay.
Just to segue into nutrition. What would you say are your top 3 food items that are absolutely critical for high density lipoprotein to really get the HDL levels up through nutrition, improve the potential of your cardiovascular system? And then give us the opposite. What are the 3 you got to really watch out for these 3?
Yep. Very good question. Number 1 is going to be very obvious. Extra virgin olive oil. Always measure out because you'd be surprised at how much calories it could be. It's one of the main components of especially the Mediterranean diet. It's scientifically proven to help not only decrease inflammation internally and specifically with around your heart, but also it has been proven to increase HDL levels and reduce LDL. So that's one of the main components. Fish, of course, is top notch, white flaky fish. So like a cod, tuna, salmon, very ideal because of how nutrient dense that is. Right. Different fatty acids. This is going to help us once again, dealing with inflammation internally. And I know that term's used a lot, so I'll try not to overuse it because people just feel like that's a very big buzzword. But for this, it's truth. There's Mediterranean diet is one of the main things, even if you look it up. But something I want to just emphasize is whole foods, meaning vegetables, fruits, but predominantly vegetables being a key important in each meal, having your serving sizes and having enough of them. Because what's that going to also do? Not only help us with fiber intake, that's going to obviously help us feel a little bit more full, which could be beneficial for fat loss, but also we get so much micronutrients from different vegetables and they're all varying. And it's a very interesting thing to me. And it's confusing. Don't get me wrong. If you're not in this field, it even sometimes still confuses me, to be honest. But at the same time, when you look into it, seeing food as medicine, that's going to be the main thing is where do we get that from? Is being whole foods and having actual quality foods. Fresh is what I mean. Now, if I had to go into 3 of the, let's say, I guess no-nos or anything, of course, some people will say, well, are you going to say red meat or whatever? Not necessarily. Now, there's varying degrees. Red meat's a very loose term. And remember, this is for individuals either dealing with cardiac disease or their main focus being preventing it. So I know there's a lot of people like, oh, ribeye, that's not that bad. Okay, if you're 5 years old, of course not. So that's not who I'm talking to. But like you said, 3 to 4 ounce filet, that's very different than a 20-ounce ribeye.
My heart just stopped when you said 20 ounces of ribeye. I could barely eat 6 ounces of a filet, and that's a filet or a top sirloin center cut. Those are the leanest of the red meats. I mean, pork, if you cut the fat cap off of pork, it's pretty lean. It's got the same almost near caloric value of poultry, well, at least white meat poultry. But I don't want to derail you.
Saturated fat, being on the top of that regarding cardiac health, it's not to say stuff has saturated fat. It's not the end of the world if you have it, none of it, but it's about a recurring thing. If you can have less of it, let's do that. Here and there is no big deal, just like anything. Number 2, I would have to say is butter as well. Now, I'm not saying you can never use it, but this is a dose thing. We'll spread butter like there's no tomorrow. Oh, I got a piece of bread. And it's like, is that bread? Like, I don't even almost see any under there. So this is kind of a little caveat because it's like there's a yay and a nay to it, but it's good sparingly. Now, of course, too, cooking with it is a little bit different than lathering it on stuff. When you cook with it, it's not going to be as dense. So, and then my third, what really, not that this is going to be a shock, but processed food, but especially processed meats. Now, once again, what you do here and there is no big deal, but processed meats, there's a lot of fillers in there. And when I'm talking processed meats, of course, deli meat is on the top of that chain. Even grounded meat to some extent is you want to be careful with, like the sausage and the bacons and things like that. In combination of the saturated fat, it's not a very high quality protein. So that's also going to lead to less desirable outcomes. And people say, well, why? Well, those are higher in fat. So it's not a positive thing for cardiac health specifically. And processed meats, it's more of the fillers and the preservatives that are in there. Now, that's not going to be like, it's not like you can never have sandwich or anything like that. Those ones are not, and there's levels to it. There's more quality meats, but ideally avoiding that more than having it consistently.
in general that anything that is processed should be strategically eliminated from one's diet. And what's funny is I think that most people know that, but I don't think they understand that saturated fat isn't really as evil as it's made out to be, at least by media or even the government. Now, basically the government owns all of the food products in the United States, and you can't trust that for shit. So you got to be really careful. But I want to come back to the actual science. Could you just very briefly tell us the difference between mono, polyunsaturated fat, and saturated fat?
Yeah, there's varying degrees of it. Mono, as you see, if we're going from a chemical standpoint, it's going to be that one double bond in the structure. This is essentially what's going to be like helping decreasing any risk of types of cancer. Whereas the polyunsaturated fatty acids are having a little bit more anti-inflammatory effects, but that one's a little bit more focused with impact on the brain, health, and cognitive function. Those two specifically both help with inflammation, as like we've said a few times, is a buzzword, but it's going to help decrease with that. However, just to what extent? Saturated fats are going to be higher in things like meat, essentially fattier meats, where there's not as much bioavailability in regard to the benefit that the mono and the polyunsaturated fats are going to provide.
Bioavailability is much higher in those two.
Right. So those, I would say, obviously are going to be more of, if we're keeping it on the same topic, having more decreased inflammation, whereas saturated fat, I don't want to directly say it, but in excess is going to lead to more inflammation internally compared to mono or polyunsaturated.
And I want to also point out for all of you who are listening or watching, notice that all the things that are healthy for your heart are fats, but I thought fats were bad. They're not. You've been lied to. So bring it home with that. And then we'll move on to some habit and mindset stuff.
Yeah, no, of course, we've already talked about a few, but avocados being great for monounsaturated. A lot of nuts and almonds, cashews, peanuts is going to be great for monounsaturated. Walnuts as well. We've already talked about olive oil, big shocker. Walnuts, like you said, flax seeds, which I'm not super wild about, at least by themselves. So you kind of got to get creative with, especially chia seeds as well for polyunsaturated. Those are both polys, a little bit more creative. So the best thing, like we've already talked about, is fatty fish like salmon, tuna, mackerel. That's going to be ideal. This year, I made an admission that I want two things. I want to have more fish and more fruit. As weird as that sounds, I've always been pretty good with vegetables, lunch, dinner. I've been structured, but those two, it just, I don't know. Fish is a little bit more work. You got to like get in at the right time and things like that. It not only has helped me regarding energy levels, things like that, but I'm excited because it also has improved my lipid panel. It did improve my HDL and reduced my LDL a little bit, even just from doing it for is like I've basically been doing it since December. So that's pretty cool as well. Some people just don't like it, but if you don't mind it, make it a staple try to shoot for 2 days a week if you can. And not only is it a quality protein, so it's going to help our fitness goals, but internally your body's going to look.
You know, if I had to forever for the rest of my life could only as a source of protein that was animal based could be fish, that would probably be what I would choose over anything else. When I went through the process of identifying different diet intakes, I found that I wanted to experiment a little bit more. So every fad diet I have done, and I did this with that curiosity. There's the scientific curiosity and there's the anecdotal aspect of it as well. Like, how's my body going to respond to it? I've done it all. I've done keto, paleo, veganism, vegetarianism, pescatarianism. I've done Whole30. I've done Mediterranean, and the list goes on and on. For those of you listening, just remember, if you do a diet, it is because somebody's making money off of you. And you don't need to do that. All you need to do is eat whole foods and not eat above your calories or eat towards your goal. So just to be clear, everybody likes to overcomplicate nutrition because that's what sells. But coming back to what I was going to say, when you are eating very healthy foods, you feel so much better and you perform better. And I can't help but think that somehow, some way that translates cardiovascularly. And then when I start looking at the data, I'm like, oh, no, yep, that does. Like you said, you hook people up to machines. You're not just thinking, oh, yeah, that looks like that person's recovering nicely from that heart attack. You can actually see the heart algorithm. You can see the EKG. You actually understand stroke volume. You know what their systolic and diastolic pressures are. Now, I don't know if in your world, do you check plasma, hemoglobin, and oxidation in blood?
No, not in my clinic, but I do actually. It's funny you bring this up because we can tell too when someone has had maybe a little bit extra food on the weekends, whether it was dining out or it was, let's say, fast food, or maybe they had excess alcohol consumption, and it'll be usually one of two things or both. A much higher resting blood pressure. This is acutely, by the way. This isn't like something that follows them for the rest of their life, but let's say they did it on Sunday and they come in on Monday, and we'll see their EKG actually have what's called PVCs or premature ventricular contractions. Right. This is essentially, it's an extra beat that comes from the bottom portion of your heart. And now, one, we all probably have them at some point. It's not a huge concern. However, if they become more relevant, it can lead to a potential deadly rhythm. So one in itself, you and I could be having some right now, and it's no big deal. It could be from extra caffeine. It could be from a lot of different things, but it's ironic that what you're saying, you're kind of putting garbage in you, and your body's message is, hey, I don't like this. I'm kind of out of my homeostasis. I'm not feeling like I should. Whereas obviously, if you're going to be taking a more of a whole food approach and having proper hydration, things like that, we're going to see a lot less incidences.
Let's circle back around to caffeine. It is a major problem in the United States. It's a psychotropic. It mucks around with your resting heart rate. But why don't you speak to that? The data is clear. It helps triathletes, especially the 70s and 80s when it was originally used. These guys were doing ECA stacks. Are you familiar with ECA stacking?
No, I can't say I am actually.
So ECA is ephedrine, caffeine, and aspirin.
Yeah. Okay. Yeah.
I don't believe there's any states currently in the U.S. where ephedra is legal. I don't think so.
I'm almost positive it's none.
So if you took 25 milligrams of ephedra and you were to compound that with 25 to 50 milligrams, so sometimes 100 milligrams of caffeine with aspirin, because it's an anticoagulant, thins your blood.
Blood thinner. Yep.
Yep. And so what you end up getting is like one hell of a rush, man. When I started in the industry in the early 2000s, they call it the poor man's clenbuterol. Now, clenbuterol is a bronchodilator, which is illegal in the United States. But for those of you who don't know, I'm not by any means an advocate for anabolic steroids or any form of performance enhancement drugs, but I want to make an amendment to that. I'm curious to see what if, since everybody's already doing it, these Hollywood celebrities who pretend they're not doing it, bullshit. You have all these sports guys who are saying they're not doing it, bullshit. You can tell. Everybody knows it. Here's the thing. I don't really care if they do it. I really don't. What I care about is that they lie about it. Yeah. Right. That fucks you and me up, because then we get people who want to work with a coach and they're like, I want to look like X actor on X movie. And you're like, well, unless you can afford $10,000 worth of performance enhancement drugs per month and you can dedicate 2 to 3 hours per day and you're willing to eat 6,000 to 8,000 calories per day, that ain't happening. And that's where social media just screws everybody up. I want to mention this. What if we just said, fuck it. These guys want to kill themselves early with steroids and performance enhancement drugs. Let's create a league for every major sport and let people go hog wild and let's see what happens. Let's get these guys who are already like 6'5" that are linebackers in the NFL. And let's let them go out and just be open, plain about it. Put them all in an arena and let's see what happens. Thunderdome.
Obviously you and I, but just our industry, because people get extremely unreal expectations. But what I'm saying is they make their life about working out. So Mark Wahlberg has said this, that when there are certain roles that it's more kind of fitness based, or they're going to have that look, they're working out 2 to 3 hours a day. They're going through strenuous stuff, having one-on-one personal training, having a dietitian at their home, even chefs, things like that. It's like the average person, they're just not going to be able to afford that. We got to go to work. We got to do things. So it really does tarnish expectations. If you're going to do it, like you said, just be honest about it. It's my thing too.
So I'm going to definitely circle back around to social media and how it influences things, but I want to just capstone our cardiovascular work here.
Yes, please.
Since we just talked about the usage of performance enhancement drugs, and some very, very, very popular and known users of steroids have had cardiovascular problems, namely Arnold Schwarzenegger. This is not uncommon knowledge. This is very well known. Can you explain how that happened? Like, why is that so dangerous?
Well, very good question, because not everyone who does steroids is going to necessarily have a cardiovascular event. It does seem to be more common, but what we're seeing is individuals like you mentioned, Arnold Schwarzenegger, they take so much, and I'm not advocating for steroids here. That's not what I'm saying. Just like anything is a dose response, but bodybuilders are on a different level. They're not thinking past I'm generalizing here, but they're not thinking past their physique at that time. It's okay. I got to get, more muscle mass. I'm competing for Olympia, whatever it may be. Now that will lead you to thinking more is better. And so you're injecting more. This is going to make your blood thicker. It's proven. The viscosity of your blood is going to be thicker from the anabolic steroids. Now the mechanisms and all that don't have it specifically off the top of my head, but for certain, you're going to see that. And what's that going to do? That's going to make your heart pump harder and faster than it needs to, not only at exercise, but at rest, while you're sleeping, while you're doing anything. It's not always about getting your heart rate up. This is important, but also seeing a lower resting heart rate is ideal as well, because when we're exercising, we want to see our heart rate in specific zones. When we're resting, we do not want to see them even close to that zones. So we're giving it time to recover. So it's essentially, we're giving our muscles an advantage with obviously the anabolic steroids, but we're giving our heart a disadvantage, because not only are we gaining size usually at a rapid rate if we're doing that, but at the same time, that's only making it harder for your heart because you're getting bigger, and now your blood's thicker from the anabolic steroids. So it's kind of just multifaceted, and it is very interesting because we've seen it, a direct correlation, but unfortunately with the United States, with anabolic steroids, they're illegal, but even for research purposes, we can't go that route, which I think is a disadvantage, to be honest. It would be good for us to see what the varying extent it is and have more actual data on it as opposed to a little bit more anecdote, because the data we do rely on from is usually from Russia or from other countries where they're allowed to at least research with it, or if it's legal, of course.
What you're saying is that you feel like the research has been stunted because we aren't actually researching it clinically by putting people on steroids and checking it.
Yep, exactly. I do think we are doing all of ourselves an injustice. I mean, maybe there is a varying extent where it's beneficial. Obviously, with certain guys, if they have low libido and things like that, we prescribe testosterone. I know, very different from anabolic steroids. However, usually anabolic steroids are in conjecture with testosterone to some dose, so that it's usually a hand in hand what someone's taking. It just leads me to be skeptical. I think there's more there, but I'll leave it
there. But I guess maybe my concern is that right now anabolic steroid usage is very famous on TikTok and other social media platforms. You've got these young men who are in their late teens and early 20s that are using these substances, and it's unnatural results. What I think really bothers me, it's almost like falsifying a document. They're falsifying results. And then what they do is then they turn around, they start selling workout programs, and they sell a lie, and they prey on the desperate. And so you got these kids who aren't thinking long term about how this could actually cause cardio problems. It could cause all endocrine problems. And I would say that the gals use surgeries, but it's still the same, right? The BBLs, the lip injections, the fillers, the breast jobs, the cool sculpting or the liposuction or the removal of ribs, all these things where they get these itty bitty waists, like it's 20 inches around. It looks weird. It looks alien.
Yeah. I mean, they're not doing it on their own is my logic, right? Someone's telling them it looks all fake.
It's all fake. And that's the problem, is that social media is the instigator for this movement. But we can keep the cosmetic surgery and the anabolic steroids in the same vein, because what they do is they give people false hope, and it's all lies. It's smoke and mirrors. But there are young men who are on social media that are juicing so hard. It's so obvious, brother. And they're talking about their new workout plan that they have and this new diet program that they're on. And by the way, notice my supplements that I'm selling. Then you have the girls on the other hand, and then they whine into the microphone. Anyway, here I am. I had my coffee this morning and I'm doing my glute kickbacks. And look at this creep over here. Oh my God, this guy's looking at me. And she's about to post this shit on social media for millions of people to see. And the best part about it is she's like, anyway, so I'm doing my workout and I'm manifesting and I'm going to be my most feminine self. And what they're really saying is subscribe to my OF. And it's all fake. And people gravitate towards this in a way that I just don't understand. But coming back to what I was saying is that it really does sow seeds of absolute false hope. And it preys on the desires of people to be fit and to look good and to be attractive. And it hurts men and it hurts women, and nobody's winning. Nobody's winning from social media. I know we've gotten completely off topic from cardiovascular, so I want to bring that all the way back around. What is your top cardiovascular health pillar? The one thing that can hold you up?
Daily movement. Avoiding sitting at all costs. I'm not saying you can never sit, but if we really wanted to get to it, it's sedentary behavior. And I know, once again, nothing I really say is going to be like cutting edge, but it's a lot of simple stuff that I think we overlook.
Sure.
And that's really what it is. Because let's say, for instance, and this especially goes to a lot of 9-to-5ers who are like our clients. They have a job where they have to sit all day, every day. It's tough. But even if you're exercising 3 times a week, that's probably not enough to prevent against heart disease. So what we want to do is try to find a little bit more movement, stay active in other ways. Now, I'm not saying in substitute of exercising. Let's say that's already said and done. You have your exercise plan. But we only are standing or moving when we're exercising, it's honestly, we're leaving a lot on the table that we could really, really be capitalizing on. Because like I said, all exercise is good. Not all exercise is created equal. But at the end of the day, if we're getting our quality exercise, the rest is like extra credit. Even if you're walking your dog, even if you're moving around your neighborhood, whatever it may be, riding bikes with your grandkids, your children, it doesn't have to be a HIIT workout, but get your butt up, get outside and get some form of movement.
I think that people kind of get stuck in the complications of this, that they get overwhelmed.
That's exactly it.
They feel like they have to do it all. If you think that you could simply do 150 minutes a week in this modern world and have optimized health, you might need to reevaluate it based on your current condition and circumstance. There is a chance that if your job is super sedentary, that you might have to do more in order to optimize your well-being.
I want to add in on this because I want to clear any potential confusion. I briefed on the 150 minutes of moderate intensity. Remember, that was on the low end. I did say that, right? No, people who were saying, well, then, so what's the sweet spot? My recommendation, honestly, would be getting your 150 minutes. That's 60 to 80%. Even if it's yard work or whatever is not sitting, we'll be good. Now, let's say you aren't going to do that or you don't have the time or whatever, then we would probably get closer to that 300 mark because it's a range of 150 to 300 minutes of moderate intensity exercise. I like to tell people 150 and then be more active in other things because I think it also ends up improving quality of life. So whereas if it's just, okay, 300 minutes and you're doing that on your bike or your treadmill, to me doesn't improve your quality of life in regards to perception. Whereas once we go outside and we're doing a little bit more active stuff, even light usually just makes you feel better. You feel like you're actually doing something, not stuck in a gym or your garage or whatever all day or however it feels.
Everybody should be concerned about their health. We're so focused on the aesthetic outcome.
Yes.
We're visual people, very visual, and women are becoming more visual. The data is showing. Instagram and social media particularly have shown that women are extraordinarily visual as well. They're just visual in different things. And we're so easily manipulated into quick consumption. And we don't necessarily consider the efficacy or the value or the truth behind that consumption. I would say we become paralyzed with information. People don't know what's real. They just gravitate towards what sounds good to them or what's easy. So it's the path of least resistance. And I think that's what the human mind does on social media.
People are able to run with a lot of things now. And whether it's the newest fad diet or like you said, talking about people who haven't really trained clients, but they look jacked and they're promoting themselves as world-class trainers. And that's what I like about Forge and our company is that's not going to deter us anymore. If anything, it just makes for a funny conversation.
Makes me want to show everybody that's not how it works. It motivates me.
Tell all our new clients when they're coming with me in our first meeting, I tell them every time, we hope that this is your last stop with fitness and nutrition. Meaning
Absolutely.
we're giving you the tools that you need to not only excel, but actually grasp the concepts that go into what should I eat? What should I maybe not avoid, but have sparingly or avoid depending on your circumstance. And of course, getting the exercise basics and why we do certain things. Usually most clients don't care about that too much. They care more about, as dumb as it sounds, how to eat. I know it sounds like, but there's a lot of people who don't. I don't shame anyone for it because like you said, the fad diets. And what I've noticed, especially in the United States, I've only gone to one other country. Well, actually gone there is Greece. But I learned and what I noticed is of two things is they obviously don't have as much food available as far as like there's not a McDonald's, Wendy's on every corner. So that helps. But we put a lot of emotion into our food, meaning we have it's our child. Like what's a very common topic right now. And whichever way you feel about it, but seed oils. And it's funny to me because what I think is how are we not all on the same page? Like maybe there is something to this. Shouldn't we at least look further into it before we're like, they're not good or they're fine. Well, I know there's research saying it's fine. There's research saying it's not. So if we want to sit here and go back and forth, how are we not like, maybe there's a better alternative or maybe we could demand more from the food companies to have a higher quality oil source? Because at the end of the day, like you said, they're not doing it because it's the healthy thing to do. It's because it's the cheaper thing to do. And where I get very, very irritated is when we start to turn on individuals. No. Let's call for more from the companies making the food and putting it on the shelves and selling it because I think we should hold them accountable because at the end of the day, you know what? If we don't buy those products, they go out of business. They have to adapt to what we want. We actually hold the cards there. So why not exhaust the options? And that, not just that one thing, but a lot of things. We're seeing it with food dyes and things like that. I don't have a whole meta-analysis to back this up. I know everyone's a research zealot now, but at the same time, we know there's something there. Like, let's be real. There's something in our foods. Something's going on. I think we should all get on the same page and at least demand more transparency.
How would you respond to the fact that the federal government has enabled and encouraged that behavior through crony capitalism? There's a difference, by the way, between capitalism and crony capitalism. What would you say if you knew that the federal government was actively involved in the manufacturing, distribution, and promotion of foods that were known to be less than healthy?
It wouldn't surprise me at all. I mean, I obviously have my own bias here, and why we have people pleading with ultra processed foods like it's a necessity to life always has me a little like just confused. I'm not even judging here. It's not, but why are we acting like this is a necessity to life? If it is harming not only you, but potentially your kids, or wouldn't we want more transparency? And like I said, I think we as the people have a lot more control than we think in regards to what products we buy and what we demand. All they care about is the dollar. So if it starts going, their profit starts going down, they'll adapt to what we want. That's what food companies do. As you see it now, there's a lot more places coming out trying to cut out certain seed oils and cut out different things, use butter again instead of maybe seed oils and things like that, which we can get into the nuances of it. But at the same time, there's certain things that have been around a long time. They even go back to the Bible. You don't have to be religious to realize certain things have been around and used a very long time. Maybe there's a reason.
Mm-hmm. And seed oils are not one of them.
Hey, and you know what? And for all the seed oil lovers out there, they'll disagree with you, but I think I'm not demonizing one thing. So I do want to say that. And I don't think that's, oh, we get rid of that and we cure everything. No, absolutely not. Yeah. But at the same time, when there's certain things you look at and there's just extra oils or extra ingredients that are just in there, wouldn't you rather have less things in there? I mean, sure, from a taste standpoint, maybe it makes it taste better. And if you can honestly say, you know what, it might be killing me, but I like the way it tastes, then go about it like that. But let's stop kidding ourselves that it's healthy or okay for us, because it's not looking that way.
Yeah, take away predisposition for heart disease. Let's just talk about the average person.
Right.
If you have healthy habits that are aligned with your longevity and outcome for your physicality, you have to have a fitness and nutrition protocol for your life that is reinforced by foundational habits that support those so you are sustainable in your efforts. And that is so difficult for people to grasp. All right, my man. Well, I'm going to close this out. It's a pleasure to work with such talented and empathetic and professional characters such as you.
Likewise.
Having you as part of this team is such an amazing blessing to me. And having spent time with you in real life, you and I share similar values. We actually really care quite deeply about the success of people in their fitness, nutrition, and habit. We chose this profession because we do care. We're coming from a place of authenticity. We're being very serious about it. For those of you who are listening or watching, Coach Cameron is fantastic. While this emphasis was on cardiopulmonary recovery, it's not so much that that's all he can do. It just happens to be something he's really, really good at. But he's very good at strength, power, hypertrophy, cardiovascular endurance, obviously. Anything that you could imagine. He's a clinical physiologist. He has advanced education. If you want to accomplish just about anything, it could be a sport, it could be fat loss, it could be muscle gain. He also has a very good, strong handle on nutrition. So I would encourage you, if you're interested, to go to forgept.com and just sign up. Or you can even book a free consultation and meet with him one-on-one. He does that. He literally gives his time. All of our coaches give their time to speak with you so you can actually really meet with them in person and then decide if you want to work with them. I will tell you this. Cameron, if he has 10 people get on a call with him, at least 8 of them are going to sign up. That's how good he is. So I just want to say, go to forgept.com. Cameron is accepting new clients. It doesn't matter what your goals are. This man is capable of taking you to the next level. So Cameron, anything else that you want to end with?
I just want to say you lead by example. So I just follow. Appreciate you and the company as well. It's been fantastic. Living my dream is something I've wanted to do for a long time. I need to give me the platform to be able to do it.
Well, we're going to have to plan an in-person again very soon.